Good morning, everybody. So I will be talking about the role of angiopoietin 2 in AMDs and DMEs. As it is a new molecule, I'll be talking about its main pathophysiology. This is a disclaimer that Roche doesn't promote any off-label drugs, or please use with caution. So I'll be starting with what angiopoietin 1, normal levels of angiopoietin 1 does in the body. So angiopoietin 1 will bind with the tyrosine kinase receptors. So this binding promotes the vascular stability. Normally there will be a balance between the angiopoietin 1 and 2. So in healthy vessels, the angiopoietin 1 and tyrosine kinase signaling promotes the vascular stability. You can see the intact endothelial cells, pericytes. But when there are few conditions, retinal vascular diseases, AMDs, RVOs, diabetes, so there will be an imbalance between the angiopoietin 1 and 2, which we call it as a angiogenic switch. So this has been studied in various human vitreous samples, and the levels of angiotensin 1 when compared with the angiotensin 2, if you see the graph on the right side, you can see the angiopoietin 2 levels are significantly higher in various retinal diseases. When the angiopoietin levels are higher, they compete with the angiopoietin 1 for the tyrosine kinase, and they sensitize this tyrosine kinase that inhibits the vascular stability. Along with that, they will sensitize the blood vessels to the effects of VEGF. So VEGF-A also binds with the VEGF-R2 in higher levels of angiopoietin 2. This VEGF again promotes endothelial cell apoptosis and other factors which we know from many decades. So basically during this angiogenic switch, like I have said, angiopoietin 2 upregulation, VEGF upregulation, finally leading to vascular leakage, neovascularization, and inflammation. This is how the angiopoietin binds. And there it sensitizes the blood vessels to inflammatory markers, cytokines, further elevates the VEGF-A levels, and vascular leakage and neovascularization. There are various studies. These are all animal studies. So this is one Miles assay where blue dye, Evans blue dye has been injected into the mice intravenously, and after 2 days, they have intradermally injected cytokines, VEGF, and then they have checked the vascular leakage. In the angiopoietin deficient mice, the vascular leakage is significantly less. And this is another study where they have noted on the neovascularization. So they have taken breast tumor cells, they have cultured, and then they have cultured in an immunocompromised mice. So when they have the tumor mass has reached to a significant size of 150 cubic millimeters, so they have collected the tumor cells, and then they have been exposed to anti-VEGF-A, anti-angiopoietin, and then a dual mechanism. After a few days, they have studied, and then they have noted the neovascularization has been significantly reduced in the dual mechanism, and the pericyte coverage has been increased. This is another study where they have clinically induced choroidal neovascularization by producing laser spots, and the intensity of the choroidal neovascularization has been assessed at the 14th day by FFA. They have graded based on the hyperfluorescence, and then after injecting on the 15th day, and then they have again studied on these mice at the 28th day. So there has been a significantly reduced leakage in the combined and dual mechanism. There is another study which has shown the endothelial barrier function, TEER assay, transendothelial electrical resistance. So stem cells, human stem cells have been filtered, and then they have been cultured, and they have been exposed to VEGF-A initially, and after 18th day, these cells have been exposed to different strengths of dual mechanism drugs, 0.5, 0.3, and 15 nm. So all these angiopoietin 2 combined mechanisms has shown a significant endothelial integrity. So like I said, the release of cytokine sensitizes the blood vessels, and apart from VEGF, they also lead to inflammatory mediators, macrophages, leukocytes. So this is another study which they have proven the cytokine production, which is higher in normal cells, has been reduced with dual mechanism. So they have done a cecal ligature puncture into the mice, and then they have taken the organs after sacrificing the mice, and they have studied the kidney and liver cytokines. Another study which showed their role on leukopoietic adhesion. So this is another one where they have injected single intraperitoneal injection lipopolysaccharide and then induced uveitis in these mice, and they have sacrificed, and then they have studied the retinal microscopy where they have seen leukocytic infiltration in a wild scenarios. So dual mechanism has been proved to synergically reduce the macrophagic infiltration. Always there should be a balance which needs to be maintained that has been disrupted in these diseased conditions. There are other exploratory research happening whether they role in any fibrosis and integrins pathway. I'll skip this one because these are all on the exploratory conditions where they will be dealing with the pericytic apoptosis and astrocytic apoptosis. So angiotensin 1 activates the Tie2 receptors, and angiotensin 2 and VEGF are upregulated in the vitreous of people with disease conditions. So this angiotensin 2 inhibits the Tie2 receptors and promotes the inflammation. So a dual mechanism has been shown to increase the vascular stability. So faricimab is a bispecific antibody that independently binds and neutralizes these both molecules. This is a faricimab where one end binds the angiopoietin 2 and the other one binds with the VEGF. Together, the neutralization by faricimab may lead to more sustained stabilization of the vessels as opposed by the VEGF-A inhibition alone. Thank you for your patient listening. And Vabysmo stands for VEGF, A for angiopoietin, BYS is a bispecific, and MO is a molecule. Thank you.
Thank you, Rajesh. It's a very quick and crisp presentation. If I see till now, anti-VEGF agents only were targeting the VEGF growth factor. Maybe 30 years ago when I was in Hopkins, we were simultaneously looking after a lot of molecules. And that MMPs is one of the agents we said can be very effective in regressing the new vessels. The other agent which I work personally is tyrosine kinase inhibitors. And if you see what ANG2 is a tyrosine kinase inhibitor, which work was getting done for past 30 years actually. So I'm very happy that people started thinking apart from VEGF, there is some other agent, so that a blanket means all agents need not be effective, like only VEGF will be effective in CNVMs. There is something else which also is required. And this very fact was proved by Narayan Netralaya. They have studied in DME patients actually. They taken the aqueous and then they measured all the levels of VEGF and angiopoietin also. And they found that some patients who are resistant to anti-VEGF injections, their levels of interleukins were raised, means there is an inflammatory component. It is not only angiogenesis that need to be addressed, but the inflammatory component also need to be addressed. And I'm very excited, though I'm very new to this molecule, I'm very excited because it's a blanket. Again, it's addressing the anti-inflammatory and angiogenesis. And I feel that whatever my experience in the lab or in the clinic, I feel that it may address a lot of clinical cases which were resistant to some of the very effective anti-VEGF agents.
Just want to make
Thank
a
you,
point.
Rajesh.
Rajesh, Rajesh, what are the normal levels of Ang1 or Ang2 in the blood of a human being?
I actually don't know, sir, but I have asked them which structure of the eye is actually producing this. So, the angiopoietin 2 is produced by the pericytes, and angiopoietin 1 is produced mainly by the endothelial cells. The actual levels, I am not sure.
So, okay, in any case, you see, there is a lot of excitement considering the dual mechanism. As Dr. Ajit Babu was saying that we have had, anti-VEGFs available. Like I say, even aflibercept has that advantage of increased duration. And aflibercept 8 milligram also is on the line. But this molecule, because of the, what you said, double mechanism of action, although we, in India, I don't think so anybody has given any injection, but there is a lot of excitement, and we know that in US and other countries, a lot of people have shifted to, any idea how much
Sir,
percentage?
in one of my slides, I'll show you how much the angiotensin 2 is inhibited in all the diseases like DME, AMD, and things. One slide is there.
So, okay. After having understood the role of Ang1, Ang2 in this diseases, now we'll have some clinical diseases like nAMD and DME, where we yes.
Yeah, just one comment before we move ahead. So why this molecule is promising is because it is targeting the basic pathology. What we see here is the endothelial tight junctions which become weak, right, in patients with diabetic retinopathy in general because of diabetes mellitus. And we know that angiotensin 2, as was described, supports that. So we have a molecule here which is not just blocking the VEGF but also going and attacking, or rather the targeting the basic pathology here.
That is the real excitement.
True.
That is the
Yes.
real excitement.
Correct.
That here is a molecule that targets two pathways.
True.
So
Bhavik.
there is the reason it's bispecific, and there are
No. The basic pathology in all this, they have all proved that the leakage is decreasing with even anti-VEGF agents also. In the basic experiments, this is common pathway we do actually. We have worked with all the lasers also, the amount of leakage, and we have seen some models of mice where the neovascularization also has happened, and we have reduced it. In diabetic mice, actually that is sugar diabetic rats are there. We have studied that also, and the amount of the angiogenesis that happens and inhibition that happens, that also been studied. But when it comes to the clinic, the effects are different. That's why it is exciting. And two different pathways always will be better than one pathway, definitely. And we will see whether it is clinically be very effective or not.